Okay, welcome to Pathophysiology 1 or Bio 240. This is Dr. Karagesian or Dr. K or Dr. Greg, whichever you prefer to call me. And I am doing voiceovers for this course, for Pharmacology 1, for Pathophysiology 2, and Pharmacology 2. Plus likely some other courses that you'll be hearing my voice. So as well, there will be tutorials in this class. The PowerPoint starts in this module with some basic concepts of chemistry, and then it will quickly go into more specific concepts about molecular processes in the body. And as the course continues, I can advise that you concentrate on the slides and concentrate on the voiceovers as homework, and of course the associated chapters in your textbook. And I think that will serve you very well. So in previous semesters, when students concentrated on those three areas, textbook, PowerPoints, and voiceovers, they typically did quite well in the exams. Okay, so I'm sure your specific instructor will also give you some advice on studying. That's my advice on how I would study this course, so that you get a good grounding of the information. Okay, so let's just talk about some terms first before we get into specific topics. So pathogenesis versus pathophysiology. So pathogenesis is really how did a disease develop. So for example, if we're talking about asthma, how did asthma develop? Is it an autoimmune disease, meaning is it the body's own response that's affecting the lungs? Or is it from pollution? Is it a genetic inheritance type condition? So pathogenesis is just telling you how a particular disease develops. It also describes the chain of events that lead to a disease. So the chain of events of how someone who is smoking gradually leads to emphysema, or what we call COPD, chronic obstructive pulmonary disease. Okay, so it is describing a disease, but it's really describing how someone got to developing a disease. Okay. Now, pathophysiology is the interaction of the pathology, so the disease that's present, and the body's response to the disease. So it's really describing that interaction of how the body is responding and functioning with a disease process occurring in the body. Okay, so really the pathophysiology comes after pathogenesis. So let me give you an example. If you have a significant injury after, say, falling 10 feet off a roof, okay, the body impacts the ground. You have multiple injuries. Say you have broken bones. Say your spleen ruptures and you're bleeding. What's going to be the pathophysiology that's occurring from this injury. And it's the body's response. So the body's going to respond to, say, the low blood pressure by increasing the heart rate, by trying to maintain blood pressure, trying to stop the bleeding with its coagulation system. So there's all kinds of processes taking place at the same time with a disease process that's in the body. Okay, and this slide really continues on with the concept of pathophysiology. So how does my body respond to a particular disease state? Okay, so say you have diabetes and your blood sugar is very elevated. That's what happens in diabetes. So your blood sugar is very elevated. Okay, how is that going to affect my body? What damage is it going to cause to my body? And how is my body going to respond to having very elevated blood sugars? Okay, and those are all questions that we'll come to as we progress through this module with different disease states. Okay, and ask yourself, why does the body do this? Why does it respond in this way to this particular disease? And depending on the disease, the body will respond in different ways. Okay, so the body doesn't always respond in a positive way. Okay, so sometimes the body responds in a negative way that seems to make sense from the system or the body's point of view, but can be detrimental later. Okay, so let me give you an example of that. Blood pressure. So blood pressure, we know, well, when we talk about blood pressure, we're referring to the blood pressure in your arteries, not your veins. So your heart pumps and it creates a systolic and a diastolic blood pressure. The systolic blood pressure is the amount of pressure that's been generated after the heart has just pumped. The diastolic blood pressure is the blood pressure as the heart relaxes in diastole. Okay, so you're left with a systolic blood pressure and a diastolic blood pressure. Okay, now in the body, in many patients, there's a blood pressure setting that the body wants to maintain. And depending on the setting, it can be detrimental to the body. So if your body's setting is a blood pressure of 180 over 100, that's systolic and diastolic, that is going to cause detrimental effects to the body over the long term. Okay, so now we would study the pathophysiology of hypertension. What will this condition of elevated blood pressure lead to? And pharmacology will be the study of how we treat hypertension. Because we know hypertension leads to many injuries and effects on different organ systems, we spend a lot of time trying to control hypertension. Okay, and we'll talk about many of these processes that occur in the body and what harmful effects they can have on the body. and also what is done to try and prevent those harmful effects from occurring. Okay, so if we were to stay on the hypertension subject, we know after having studied hypertension that typically a systolic blood pressure greater than 140 and a diastolic blood pressure greater than 90 over the long term is detrimental to many organs because the system is under higher pressure. So the heart has to pump harder. The kidneys are seeing higher pressure in the arteries that are feeding them, so they can start to be harmed. The brain arteries are under higher pressure, so there's potential for leakage or hemorrhages that can occur in arteries of the brain. And because the whole system is under high blood pressure, the arteries get injured themselves, and that leads to atherosclerosis, which is damage to the inside lining of the arteries, and gradually plaque buildup starts to occur. And hypertension is just one risk factor or one disease state that leads to injuries of arteries. Okay, so we can look at chain of events to actually say having a blocked artery, whether it's in your heart or in your brain. What's the pathogenesis of developing a blocked artery? Well, it's often genetics. Often there's risk factors such as hypertension, smoking, diabetes. So you can see that pathogenesis, like how did something happen? How did a disease come to be? And how does the body now respond to it? They're very closely linked. Okay, so as you go through this course, ask yourself, what's this disease causing to the body? How is the body responding to it? But also ask yourself, how did this disease come to be in the body? What were the processes that allowed this disease to develop? Okay, so this slide is just showing you a variety of different pathologies. Okay, so you can see that there's a cancerous lesion in the top left corner in the upper esophagus. There's a fractured hip or upper femur on the left side. There's a severely damaged lung in the middle, likely from smoking and pollution, and even potentially workplace inhalation injuries. And so they're just showing you an assortment of different pathologies. And what we haven't seen on this slide is what's the body's response. Okay, so always ask yourself, what's the body's response to a pathology? And often when you ask yourself what's the body's response, it's going to help you decide on what's the most appropriate action to take. Okay, so if you know that when someone has say a pelvic fracture after having fallen, well, that's the pathology. What's the pathophysiology? Well, the body is going to respond to all the bleeding vessels that are occurring in the pelvis by trying to maintain blood pressure, right? How does the body maintain blood pressure in the face of hemorrhagic shock? So we all have about 5 liters of blood in us. So in certain parts of the body, we can lose 5 liters of blood without even seeing it externally. The pelvis is one of them. The abdomen is another one, and the chest. Okay, all of those 3 sites, and there's actually one more, the thighs. Okay, the where the femur is. So all of those can actually hide 5 liters of blood. So you can go into hemorrhagic shock without actually seeing any external blood at those sites. You can fill your upper legs with blood. You can fill your pelvis with blood, your abdomen, or your chest. You can't fill your brain with 5 liters of blood. So if you're in hemorrhagic shock, and we don't see any external blood coming from a bleeding site, or say from your rectum, we're going to go looking at those sites because we know that's where the body can hold a lot of blood. Okay, so that's just an example. So what is the cause? What's the response? Now in this case, what's the response going to be? Well, the body is going to activate multiple systems to counteract the hypotension, the low blood pressure, because low blood pressure means that organs aren't going to be fed with glucose and with oxygen that's in the bloodstream. And that is critical to survival. The brain needs proper blood flow, the heart, the kidneys, multiple areas are critical at the beginning to maintain blood pressure. Okay? And in order to do that, the body's going to do everything it can to bring up the blood pressure. So it's going to increase the heart rate. It's going to pump as hard as it can. And it's going to pump as hard and fast as it can. Not just hard, but also as rapidly as it can. It's going to clamp down, vasoconstrict blood vessels to non-important parts of the body, such as the skin. So you're going to look pale. It's going to vasoconstrict the blood vessels to the gastrointestinal system. So it'll shut down the gastrointestinal system temporarily. It's going to basically just keep blood flowing to the critical areas, such as the brain, the heart, and the lungs. So it's going to vasoconstrict vessels to the kidneys. You're going to start to stop making urine. So one way that we know that someone is hypotensive or severely dehydrated is that they don't make urine any longer, right? They have decreased urine output. So by increasing the heart rate, increasing contractility, and causing vasoconstriction to non-essential areas of the body is doing everything it can to maintain blood pressure in the face of hemorrhaging. Okay, so that's pathophysiology, where the pathology is now causing the body to respond in a certain way.